Hello everyone, welcome back to week 8 lecture videos. In this video, I'll be talking about real options and decision trees. When you use discounted cash flow to value a project, you implicitly assume that the firm will hold the assets passively. But managers are not paid to be dummies. After they have invested in a new project, they do not simply sit back and watch the future to unfold. If things go well, the project may be expanded. If they go badly, the project may be cut back or abandoned altogether. The projects that can be modified in these ways are more valuable than those that did not provide such flexibility. The more uncertain the outlook, the more valuable this flexibility becomes. So there are different ways we represent this flexibility. One can be a decision tree. So in decision tree, we prepare a sequential outcome of the decisions associated with a project. So in decision tree, the companies can be helped by understanding that what are the different choices and what are the different outcomes possible and what are the impacts of these choices and outcomes on calculating the project's NPV. So you can avoid extra losses as you consider all these possible choices and outcomes. So this is a very simple example of a decision tree. You can see that FedEx expansion option. So FedEx has entered into an agreement with an aircraft supplying company to purchase an aircraft. However, that whether FedEx take the delivery of this aircraft or not, that depend on whether there is a high demand for their services. Now, the agreement is such that if there is high demand, they will exercise the delivery option, and if there is low demand, they don't take the delivery. So you understand that FedEx has imposed a risk on the aircraft producing company that in the case that they have low demand, they may not entertain the delivery option of the aircraft. So that gives a more flexibility to FedEx to discontinue a particular project based on the degree of demands or based on the degree of services they are going to provide to their customers. In general, the options to modify projects is known as real options. Now, projects may have option to expand, may have option to abandon, may have production options, and may have timing options. I will discuss briefly each of them. First of all is option to expand. You know that there can be many investment that can have the value added because there are further options associated with those investments. For example, when launching a new product, companies often start with a pilot program to iron out possible design problems and to test the market. The company can evaluate the pilot projects and then decide whether to expand to full-scale production. So as you go for pilot scale production, and if there is something wrong going out, you can abandon the project. And if you see that the project is doing good, you can go for full-scale production. When designing a factory, it can make sense to provide extra land or floor space to reduce the future cost of a second production line. So that gives you flexibility when you go to expand. When building a 4-lane highway, it may pay to build 6-lane bridges so that the road can be converted later to 6 lanes if traffic volumes turn out to be higher than expected. So you can see that all these examples give you some options to expansion flexibility with the project, which makes the project more valuable. Then options to abandon. If the option to expand has value, what about the decision to bail out? Projects do not just go on until assets expire of old age. The decision to terminate a project is usually taken by management, not by nature. Once the project is no longer profitable, the company will cut its losses and exercise its option to abandon the project. Sometimes assets are easier to bail out than others. For example, tangible assets are more easier that you can abandon them or you can sell them to get out of the investment. Then, sorry, then production options. Now, when companies undertake new investment, they generally think about the possibility at a larger stage that they may wish to modify the project. In that case, you need a plan that provides the flexibility to produce a variety of products or variety of designs. And last of all is timing. The fact that a project has a positive NPV does not mean that it is best to undertake now. It might be even more valuable to delay and start the project sometime in future. Timing decisions are fairly straightforward under conditions of uncertainty. You need to examine alternative dates for making the investment and calculate its net future value at each of these dates. So as you calculate the future value, the ultimate date to undertake the investment is the one that maximizes its contribution to the value of your firm today. So you can consider different future values and you compare among the projects and find out which one contributes most to the value of your firm, and you undertake the project at that time. So the projects that gives you these timing options that you can start the project at different time period, then these projects are more valuable to you. Now, this is an example of a decision tree. This is a decision tree about a pharmaceutical research and development. Okay, a candidate is a drug that requires an 18 million investment for phase 2 clinical trials. You can see this is a $18 million investment is required. If the trial is successful, and there's a possibility of 44% that it will be successful, the company learns that the drug's scope of use and update its forecast of the drug's present value at commercial launch. The investment required for the phase 3 trials and pre-launch outlays is 130 million, you can see, and the probability of success is 80%. Okay, so this is all about this decision tree. Now, you know that pharmaceutical research and development generally have different stages. For example, stage 1, stage 2, stage 3, like this. We have assumed that the drug has passed the trial 1, clinical trial 1, with flying colors. Now it requires an investment of $18 million for the second trial, second stage clinical trial. These trials take 2 years, and the probability that it will be successful is 44%. Now, if the trials are successful, the manager learns the commercial potential of the drug, which depends on how widely it can be used. Suppose that the forecasted PV at launch depends on the scope of the use allowed by the Food and Drug Administration. These present values are shown at the far right of the decision tree. You can see the present values. An upside outcome can be $700. As you can see, NPV of the drug can be widely used, and the most likely outcome is 300. So if it is used moderately, then it will be 300,000, and a downside NPV is 100 million if the drug's use is very much restricted. The NPVs are the payoffs at launch after investment in marketing. Launch comes 3 years after the start of the phase 3 if the drug is approved by FDA, Food and Drug Administration. The probabilities of upside, most likely, and downside outcomes are 25%, 50%, and 25%. A further R&D, research and development investment of 130 million is required for the phase 3 trials and for the pre-launch period. Okay. Now, let's value the investment in this figure. We assume a risk-free rate of 4% and the market risk premium is 7%. If Food and Drug Administration approved pharmaceutical products have asset betas of 0.8, the opportunity cost of capital will be somewhere in 9.6%. So, and you can see that considering these possibilities, additional investment, and these possibilities, the you can see this is the NPV, this is the upside NPV, 295. So 130 is the investment. This is the this is 560 considering the payoffs, and NPV is 295. So that was our upside NPV. And similarly, our most likely NPV is 52, and our downside NPV is 69. Suppose that the downside NPV, you can see that the downside NPV is 69 negative, and the 130 million investment at the start of phase 3 should not be made in the downside case. So there is no point investing 130 million for an 80% chance that 100 million pay off 3 years later. Therefore, the value of R&D program at this point in the decision is not the negative 69, rather it's 0. Okay, because that doesn't make sense of investing. Now calculate the NPV at the initial investment decision of phase the 2 trials. The payoff 2 years later depends on whether the drug delivers on the upside, most likely, or downside. A 25% chance of NPV 295 million, 50% chance of NPV 52 million, and 25% chance of cancellation, that means NPV is 0. These NPVs are achieved only if these phase 2 trials are successful. Okay, that means there is a 44% chance that it will be successful and 56% chance that it will be a failure, and your initial investment is $18 million. Considering this, if you calculate, you see that your NPV will be 83 million considering all this. Okay, now you notice that considering the risk associated with this project, we did not increase the 9.6 discount rate to offset the risk of failure in clinical trials or the risk that the drug will fail to generate profit. Concerns about the drug's efficacy, possible side effects, and the scope of the use are diversifiable risks, which do not increase the risk of the R&D projects to the company's diversified stockholders. So we were careful to take these concerns into account in the cash flow forecast. However, the decision tree here you can see that keeps track of the probabilities of success and failure without changing the discount rate, and the probabilities of upside and downside are considered with these possible outcomes. So this is how a decision tree helps us considering all the possible outcomes and calculating NPV and deciding whether the project should be accepted or rejected, so we can avoid the potential losses. So this is the other alternative. So this is the end of our discussion on this chapter. We will be discussing the next chapter in the next videos. Thank you very much.